All right, so today we're doing a body contouring procedure on a 52-year-old male. He's lost some weight with diet and exercise. He's very fit, takes care of himself, works out, but usually in many situations like this, when the weight loss is there's a lot of excess skin. And so this is no different for him. This is a starting point. So we're doing a body lift today. This is his posterior contour. You can see the buttock with all that weight loss is a little bit deflated. You can see the kind of the excess skin of the creases in the lower pole of the buttock. You can see these areas here is actually not fat at all. It's very little fat, it's all loose skin. And so the idea again in the body lift is to lift out the outer thigh, lift the upper buttock. By lifting the upper buttock, the creases in that lower pole are improved and it completely effaces those creases, making it nice and flat. And then of course the waist to hip ratio is improved, all this loose skin is removed, and so from the back he's going to have a really nice V taper, which will give him a really athletic, nice athletic look from the back. So upper buttock lift, a V taper, so right now it's kind of boxy, but with removing all the skin, it'll give him that nice V from the back, which looks very muscular and athletic. And then from the side, it also gives an outer thigh lift as well. So that's the benefits of the body lift. So we're done with the posterior contouring. We're going to turn him over to his tummy, onto his backside to contour the tummy. This is his on-table result from doing the backside. So you guys can see the incisions kind of flare up like this, but that's because we've been able to lift the buttock and also lift the outer thigh. Over time, the scar will descend a little bit, but it's actually hidden specifically in his boxers, and we confirmed that by having him wear the boxers and making the markings this morning. And so, we're all done with the backside. He's got 2 drains in place. Those drains will stay in for about a week or so. Now we're going to turn him onto his back and contour his front. So stay tuned. All right, so we're all done with the body lift. This is the anterior or the front view of this 52-year-old gentleman. So again, he lost all this weight. You can see all the loose skin. He's actually very athletic. He's got a very low body fat percentage, and this is a perfect example of how you can exercise loose skin. So he's at a perfect weight. You can see he's got great definition, but it's just all this loose skin here, and that's not going away with any more diet and exercise. You gotta cut it out. And so what we did was remove all the loose skin from about the pubic area to right above the umbilicus. And so again, we did the posterior contour with the body lift, lifted the outer thigh, removed all the skin. We just continued it through the front, and we removed the anterior aspect of it. So this is his on-table result. You guys can see this is time 0. You can see how flat that tummy is. I mean, I can't even pick up the skin off of the anterior abdominal wall. That's how nice and tight it is. His abdomen is like a tight drum. This tape over here is called exifin scar tape. So we start the scar process at time 0. The scar tape stays on for 3 weeks. It does an amazing job creating a very good scar ultimately. Followed by silicone scar sheeting and all the other things that we do to maintain the scar later on to help the scar along. But this is his on-table result. You guys can see even in the flank areas, there's absolutely no skin. So he's tight all the way around. All the working out that he's done is now paid off, because now if he continues to do resistance exercises and continues to take care of himself, he's going to see amazing definition, which he would not have been able to do had he not had the procedure. So he's going to have a great result, and 6 weeks is a good time to start seeing what his results are going to look like, because there's obviously some swelling. We're going to get him in a compression garment, and we're all done. So thanks for tuning in. All the skin that we removed on this 52-year-old gentleman. So the skin over here is all the skin from the back and the sides, and the skin over here is all the skin from the front, the anterior part. To give you an idea of reference, this ruler here is about 15 centimeters or about 6 inches. so you guys can see how long and how much skin is removed. Skin doesn't weigh much, so he's not gonna lose a lot of weight from this, but boy, he's gonna look amazing on the beach, which is one of his goals. So I'm glad to make this happen for him. A lot of skin was removed in this particular case, which would not have been able to get rid of with diet and exercise alone. So this is again a body lift, which is a very powerful body contouring procedure after massive weight loss.